Welcome to the Spine Surgery Pre-Operative Education class, developed in partnership with the Connecticut Orthopedic Institute and Ayer Neuroscience Institute at St. Vincent's Medical Center. As an orthopedic navigator, I will walk you through the steps to prepare for surgery, to know what to expect during your hospital stay, and to formulate a plan for after discharge. I will then work with the case managers to set that plan in motion. At St. Vincent's Medical Center, our mission is to improve the health and healing of people and the communities we serve. Our vision is to be nationally respected for excellence in patient care and most trusted for personalized coordinated care. This video is providing general information to you. Please keep in mind that your doctor may tell you something that conflicts with what you are hearing here. Always follow your surgeon's instructions. Our goal for you is to be healthy, comfortable, and active. We want you to be able to move and enjoy life, but we do have expectations. We want you to participate in physical therapy and take the medications you and the doctor have agreed upon. It's important because that is how you're going to get better. We want you to transition home and be safe. Safety is the most important thing. Before surgery, we need to make sure you are medically optimized for the procedure. You may choose to see your primary doctor for medical clearance or come to the pre-admission center here at St. Vincent's. We offer comprehensive preoperative care for all patients scheduled for elective surgery. It allows you to take care of your preoperative testing in one visit. This includes blood draw, EKG, and nasal screening, along with a visit with anesthesia nurses to gather information about your health history. If needed, the pre-admission center can also schedule a visit with one of our providers for your medical clearance. You may be told to temporarily stop certain medications before your surgery. The most common medications that are of concern are any blood thinners or cardiac medications. Your surgeon will inform you when to stop taking any blood thinners. Bring a written list of all medications with you to all your appointments. Please make sure that your doctors know if you take any flaxseed, fish oil, or vitamin E tablets. We also ask that you do not take any NSAIDs for 7 days prior to surgery. These medications include aspirin, ibuprofen, Motrin, and Aleve, as well as some prescription anti-inflammatories. These can also increase bleeding and must be stopped before surgery. Please ask your surgeon if you are unsure about any of your medications. Recovery from spinal surgery has changed. Our goal is to discharge you home as soon as you are able and medically cleared. A member of our medical team, with the direction of your surgeon, will determine when you are medically stable for discharge. Many spinal operations only require a one-night stay in the hospital, while others may result in the patient staying 2 or 3 nights. Your surgeon, as well as the case manager, will speak to you about your length of stay along with your insurance guidelines. Again, length of stay is based on medical necessity. As this is a scheduled surgery, your insurance company expects you to prepare ahead of time for when your surgeon discharges you from the hospital. In the past, patients would leave the hospital, then go to rehab for 2 to 3 weeks. This is no longer the case. We find that patients that go home do better faster. The first reason is that by being home, you are lowering the risk of infections. The longer you remain in any medical facility, there is a higher risk of infection. We want to eliminate this risk. The second reason we recommend home is mobility. For safety, a medical facility will require that you only walk around with staff. That limits how much therapy you are receiving. At home, we encourage you to walk frequently and reposition yourself throughout the day, resting in between. It is common to tire quickly during the recovery period. Our physical and occupational therapists strive to help you be independent. However, we do recommend that you have a coach. Whether it be a spouse, family member, or friend, a coach is someone who can either stay with you the first few nights or at least check in on you periodically. Your coach should be available to help you with any household chores after surgery. In rare circumstances, if there is a concern about your safety, the doctor may suggest you go to a rehabilitation facility. However, you need to be aware that insurance must approve rehab. Unfortunately, this cannot be done ahead of time. Insurance agencies will not make a decision until after your surgery. Therefore, we want to stress again the importance of preparing to return home and finding a coach for support after surgery. We encourage your coach to be in the hospital for at least one physical therapy session. This way, they can see how best to help you. Good nutrition is important before surgery. This will help make sure you will have the strength post-surgery for rehabilitation. Eating healthy, well-balanced meals include iron-rich foods such as meat, fish, poultry, or whole grain foods, vitamin C to help absorb iron, and raw fruits, vegetables, and beans make up your high-fiber foods. It is important to drink plenty of fluids in the days before and after your surgery. Starting midnight before your surgery, you are not to have any food or drink. If you are required to take medication the morning of your surgery, you may do so with up to 8 ounces of water before you leave your home for the hospital. If you drink any water, you must finish 2 hours before your scheduled time to arrive at the hospital. You should stop drinking any alcoholic beverages 1 week prior to surgery. This will help prevent excessive bleeding. Please inform your healthcare team of your drinking history, because serious harm can result from alcohol withdrawal when not properly managed. If you have questions about possible symptoms, please contact your orthopedic navigator or surgeon's office. If you need dental work, have it done at least 2 weeks before your surgery. Ideally, you should stop smoking at least 6 weeks prior to surgery. Nicotine hinders the healing process, potentially negatively affecting your quality of healing. Call your orthopedic navigator for ways to help you quit. In order to prepare your home, you should temporarily remove any throw rugs. This is a fall risk should you require a rolling walker or cane. Please make sure you have a clear pathway from your bedroom to your bathroom and to the area where you will spend most of your day. You may not feel up to cooking, therefore we recommend you have some meals prepared ahead of time. If you have pets, make sure you have someone that is able to assist you with their walks and to help you with their care. To reduce your risk of infection, we also ask you to be sure your house is thoroughly cleaned before surgery. Prepare a supply of clean sheets, clean towels for bathing, and clean, comfortable clothing to wear after surgery. If your pets usually sleep with you, try to keep them out of your bed for the first few weeks after surgery. We ask all spine patients to follow our comprehensive plan to lower your risk of infection after surgery. In addition to cleaning house and doing laundry, you will be instructed to use a special soap called Hibiclens or Dynahex. This is a chlorhexidine soap that helps remove any germs from your skin. You need to shower with this daily for a total of 3 showers. Start 2 days before surgery, so your final shower will be on the morning of your procedure. You will receive a bottle of chlorhexidine soap if you visit our pre-admission center for your pre-op testing, or it can be purchased at any retailer with a pharmacy or first aid. If you normally shave or wax your back or neck in the area of your planned procedure, you need to stop 3 days before your surgery. Place clean sheets on your bed the night before your surgery, or arrange for someone to do this for you before you return home from the hospital. The next part of our plan is usually done here in our pre-admission center. You will need to have your nose swabbed prior to surgery. It is recommended you do this within 14 days before your surgery. The lab will be checking for staph, a certain type of bacteria. If you test positive, we then have time to provide you with medication prior to surgery and use the appropriate antibiotics for surgery. Your doctor will inform you of your results. The morning of your surgery, it is likely you will be nervous or anxious. This is normal. Therefore, it is a good idea to pack for the hospital ahead of time. You should also keep a list of any last-minute questions. It is easy to forget something you wanted to ask once you enter the hospital. When packing your bags, it is important to bring certain items. If you have sleep apnea, please bring your CPAP machine and mask or mouthguard with you. You will feel more comfortable with your own equipment. You may wear your dentures and hearing aids the morning of surgery. Before you are brought to the operating room, we will have you put them in your case and they will be stored until your surgery is finished. Wear your glasses and keep any contact lenses home. No jewelry is allowed in the operating room, including wedding rings. You do not have to remove gel or acrylic nails, but we do request that you wear light-colored polish as we check your oxygen levels through monitors worn on either your fingers or toes. Please bring a list of all your current medications, including prescription, over-the-counter, and supplements. The morning after surgery, you will be able to put on your own clothes. We recommend you bring a lighter shirt as well as a sweatshirt or sweater. It is common to have some swelling in your legs and feet after surgery. Whether you choose to wear shorts or pants, it is recommended that they do not have a button or zipper. Ones with elastic drawstrings will be more comfortable and easier to put on. Sneakers are the ideal footwear, but you may choose to wear a different type of shoe. Your feet may be swollen, so bring your current sneakers rather than purchasing brand new ones. If you prefer other shoes, they should have a back to them. No slippers or flip-flops. We also provide you with non-slip socks. For entertainment, each hospital room has a television and free Wi-Fi. Your bedside table has a docking station for your cell phone. It also has its own tablet that our staff will show you how to use. It is programmed with information about our hospital, educational videos, games, and much more. St. Vincent's Medical Center provides free valet parking. If you are unable to walk into the hospital, a wheelchair and transport will be provided. Please do not bring any walkers or canes unless you require them to walk into the facility. While you are here, we will provide you with any necessary equipment. When you arrive for surgery, please enter the hospital through the main entrance and head to registration. Bring your insurance card and photo ID with you. After checking in, you will be directed to the elevators that take you to the pre-operative department. Please let the receptionist know your name when you arrive. When they are ready for you, you will enter the pre-operative area. There, you will meet your nurse. You will be asked to change into a hospital gown. As the last part of our pre-op infection prevention plan, you will be asked to use chlorhexidine wipes over your skin and to rinse with the cleansing mouth rinse. The nurse will then swab your nostrils with an antimicrobial liquid as the final step. Be sure to use the restroom while you are changing. We can store your belongings, or you may give them to your coach or family. At this time, you will be asked to lie on a stretcher. We have heated blankets ready for you to keep warm. Your pre-op nurse will ask you questions about your health and social history. Your family is welcome to join you after this and will be able to stay with you until you go into the operating room. Your nurse will go over your current medications and may ask you other questions that we would like verified. We will check your vital signs and begin IV fluids. Patients are given IV antibiotics to help prevent infection. The first dose is given just before surgery, while additional doses are given later in the day. During this time in the pre-op area, you will meet with the anesthesiologist. They will discuss the details of your anesthesia. General anesthesia is used for spine surgery. This anesthesia affects the whole body. You are completely unaware of your surroundings and will not respond to stimulation. With general anesthesia comes an intubation tube. This allows the anesthesiologist to monitor your breathing throughout the surgery. Depending on the type of surgery planned, your anesthesiologist may be able to offer you a nerve block, which helps reduce pain after surgery for 12 to 36 hours. When it is time for your surgery to begin, we will bring your family to the waiting room. They are welcome to remain in the hospital or leave the premises. You will designate a loved one to receive updates via text message before your surgery finishes, and again when you are in the recovery room. Your surgeon will call or meet with your designated family member or friend after surgery. Your nurse will be sure we have their name and phone number before you leave pre-op. You will be wheeled into the operating room, and our medical team will begin to prepare for surgery. You may feel additional IV lines being placed. Staff will be covering you with heated blankets, as it is often quite cold in the operating room. The circulating nurse will be available to you should you have any last-minute questions or concerns. The length of your surgery will depend on the type of procedure you will be having. You and your family will be told how long you should expect to be in the operating room. While you are under anesthesia, we may place a catheter in your bladder. Depending on the type of surgery you are having, we may leave that catheter in your bladder overnight. It will be removed early the next day. The first time you urinate afterwards, you might feel a slight burning or see a bit of blood. This is normal, but if it persists, alert your nurse. Once the surgery is complete, you will be brought to the post-anesthesia care unit or PACU. The length of your stay in the PACU will be determined by many factors, including the type of procedure and the nature of the anesthetic used. We also want to make sure your pain is under control, and we need to monitor your vital signs and wound. Generally, patients remain in the PACU for 1 to 2 hours. Family members are usually welcome to visit briefly and will be notified by our state-of-the-art paging system once you are ready for visitors. Next, you will be brought to your hospital room. All rooms for spine patients are private. We have many team members ready to care for you. But with so many faces, it can get confusing. Besides wearing our badges and writing our names down on your patient whiteboard, we have also color-coded our uniforms. Staff in the teal blue are the physician assistants. These licensed, thoroughly trained medical providers work closely with your surgeon in the operating room and monitor your care during your entire stay. PAs examine you daily and are in continued communication with your surgeon. At St. Vincent's, we have orthopedic and spine-trained PAs on site 24 hours per day. Nurses will be seen wearing navy blue scrubs. Our dedicated team is essential to the care of the recovery of our patients. They have expertise in the post-operative needs of orthopedic and spine patients. Clinical care associates will be seen wearing gray scrubs. These staff members will provide care to you in the hospital, such as vital sign monitoring, bathing, or toileting. Team members wearing maroon are physical and occupational therapists. Physical therapy trains you to be safe while walking or when you transfer in and out of your bed. They will also provide you with strengthening exercises. Occupational therapy helps you with how to manage self-care while maintaining proper body mechanics. There are assistive tools they can show you if you find part of your daily care routine challenging. Environmental services, who wear gray, and our dietary partners who wear blue tops and black pants are our valued team members who you will see throughout your stay. Our goal is to make your experience exceptional, and we strive to provide a clean environment and tasty meals. Our floor has its own private kitchen, allowing meals to be delivered swiftly and at the appropriate temperature. Once in your hospital room, your nurse will provide you with information on your surroundings and any equipment you may see. Normally, as we walk around, we use our full lung capacity. When we find ourselves laying or sitting for longer periods of time, we tend to do more shallow breathing, and this can lead to pneumonia. An incentive spirometer is a small breathing device that allows you to exercise or use your full lung capacity to prevent pneumonia from occurring. Your nurse will show you how it works. We encourage you to take it home and continue with your exercises for at least 1 week. As stated earlier, you will be given IV antibiotics along with other medications, and you may see this hanging on your IV pole. Along with that is often a bag of plain fluid. This is to prevent dehydration. Once you begin drinking fluids, we will be able to stop the IV fluids. Each surgeon will determine the best dressing for each patient. Most doctors will use a dressing that may remain on for several days without requiring dressing changes. You will be provided with instructions on your wound care before you leave the hospital. If you are aware of any allergies to adhesives you may have, please inform your surgeon prior to surgery. While in surgery, your surgeon may decide to place a drain. There are many different types of drains. The drain will have a small tube placed near your incision and held in position by a few stitches. The tube then connects to a container that allows our staff to monitor the amount of blood and fluid coming from your wound. If this is required, it will be removed when the amount of drainage decreases. You will not be discharged home with the drain in place. Blood clots are a risk after surgery. When we walk around, the action of our foot hitting the ground and the contraction of our muscles help push blood back up to the heart. By sitting or lying for long periods of time, it puts us at risk for forming a blood clot. An important exercise while lying in bed or sitting in a chair is to do ankle pumps. Stretch your legs out in front of you and point your toes forward. Next, pull them back towards you. Repeat these movements throughout the day. During your hospital stay, you will be wearing sequential compression sleeves. A sleeve is placed around each calf. This is connected to a machine that slowly inflates the sleeves with air and gently squeezes your calf, helping the blood to return to your heart. After a few moments, the air will release and the sleeve will deflate. This process will then repeat. When it comes to medication, things can become confusing. In addition to your normal medicine, you will now be receiving new medications specific to your surgery. The manufacturer our hospital uses is most likely different from the one your pharmacy does. Therefore, many patients are apprehensive about taking pills that look different. Medications can also have generic names or substitutions. Your nurse will always provide you with the name of each medication you are to be given and an explanation of its purpose. But we encourage you to ask questions. We would never want you to accept medication or a treatment you are not comfortable with. Our staff wants to make sure you are as comfortable as possible. One way is to keep your pain under control. We use this pain chart so that you can help guide us as to how much medication is required and its effectiveness. A rating of 0 tells us that you have no pain, while a rating of 10 will let us know you are in extreme pain. While we cannot promise you a pain-free experience, we have developed a multimodal pain management plan to help you be comfortable enough to walk, perform personal hygiene, and rest. Multimodal means that we treat your pain in different ways. Your surgeon will order you several medicines, including acetaminophen through your IV to start and later in pill form, a muscle relaxer, and anti-inflammatory medication that are scheduled doses. If you need additional pain medication, it will be prescribed on an as-needed basis depending on your reported level of comfort. Surgical pain improves with time as you move through your recovery period. We have already spoken on a few ways we try to prevent infection, including staph testing, showering with chlorhexidine soap, and cleanliness. But most important is hand washing. Whether in the hospital or home, it is critical that you and your family maintain good hand washing. To wash your hands properly, you should be wetting your hands and applying soap. Rub your hands well. Remember to get between your fingers and under nails. While washing, you should sing happy birthday to make sure you are doing this for the correct length of time. After surgery, it is very important to wear freshly washed clothes, especially while your incision is healing. When you are allowed to shower, you must dry with a clean towel, especially at the surgical site. Anyone assisting you with your dressing must always wash their hands first. Purell hand sanitizer is provided throughout the hospital. All medical and non-medical staff should be using the Purell or washing their hands before entering your hospital room and upon exiting your room. Earlier in the video, we mentioned nasal screening. This means getting your nares or nostrils swabbed so that we can test for staph. One type is methicillin-resistant Staphylococcus aureus, or MRSA. Should you test positive, you will be given medicine to place in your nares prior to surgery. You will also be given an IV antibiotic specifically for this type of staph. This is all done as a precaution to help reduce your risk of infection and protect patients. We have a lot to accomplish in the short time you are with us at St. Vincent's. You will have multiple therapy sessions. You have nurses and aides continually in your room for medication and providing personal care. Doctors and physician assistants will be assessing your medical well-being. Members of the phlebotomy team will need to draw blood. And you need to eat. Furthermore, sleep is a critical component to the healing process. We do our best to give you time to rest, but there are necessary check-ins. It is important to try to nap throughout the day whenever you get the opportunity. Our number one priority is your safety. Patients are often surprised by how quickly they are able to get up and walk around. Unfortunately, this can lead to patients forgetting to call for assistance. While you are with us, we ask that you always call for a staff member before you get out of bed. If we assist you into the bathroom, please do not attempt to get back to your bed or chair by yourself. Your surgeon may recommend you have some physical therapy prior to surgery. This will depend on how much pain you are currently experiencing and on your insurance coverage. Immediately following surgery, it is recommended that you do not participate in any strenuous activity until cleared by your surgeon. Avoid repetitive bending and twisting, but these motions are okay for your self-care. Do not lift more than 5 to 10 pounds until your surgeon says it's safe. Though you may have some restrictions after surgery, physical activity is essential. Getting up and walking helps prevent blood clots, pressure sores, and pneumonia. Your surgeon will tailor your physical therapy program to your specific needs. The Institute has its own gym, which includes required durable medical equipment, a staircase, and car setup to help prepare you for discharge home. Therapists speak with your nurses to try to coordinate your pain medication so that it is given approximately 30 to 60 minutes before your therapy begins if that is necessary. Our nurses and aides are trained to assist you to walk throughout the floors even after your therapy sessions. Our goal is to help you get home safely, so we make sure you can be independent at home. You need to be able to get in and out of bed and to be able to go up and down stairs. We will alert you to any movements you should avoid. As we said earlier, walking and movement is an important part of your recovery. If a brace, cane, or walker is required, your therapist will teach you how to use them properly. Finally, we need to see that you can safely use the toilet. Occasionally, patients having spine surgery will temporarily need a cane or walker. Your walker should only have wheels in front. Walkers with no wheels or ones with 4 are dangerous after this type of surgery and may cause a fall. Your cane should be adjustable. If it is not at the correct height, you can slowly hurt your back. It should also be a single point at the bottom. Canes that stand up on their own are not recommended, as they cause a higher risk of tripping and can perpetuate a limp. Each insurance company has their own policies on what equipment they will cover. You may call your insurance company in advance, or our case managers can assist you once you are in the hospital. Equipment can be ordered while you are in the hospital and delivered to your room. We will verify insurance coverage prior to ordering any equipment for you. Instructions on when you may shower will be included in your discharge packet. Most patients are able to shower on the 3rd day after surgery. Be sure to always dry off with a clean towel and wear a freshly washed shirt every day, especially while your incision is healing. Always follow your surgeon's instructions on incision care and showering. You cannot soak in a bathtub, hot tub, or swim until you are cleared to do so by your surgeon. You won't be able to drive after surgery until your surgeon gives you permission to do so. It is important that you plan for rides before surgery, as you will not be able to drive yourself home. You will need to have someone drop you off and pick you up. If you need assistance with transportation, contact your orthopedic navigator. Once home, you will need someone to drive you to your follow-up appointments. When it is time for you to leave the hospital, you will have a discharge folder. It will have all your medical instructions for wound care and your medication regimen. We have an outpatient pharmacy at St. Vincent's open Monday through Friday for your convenience. It functions just like a community pharmacy to save you an extra stop on the way home. They can deliver to your bedside between 8 a.m. and 5 p.m. and accept all forms of payment for any copays you may have. If you prefer to use your own pharmacy, please let our medical team know. Your nurse will sit down with you and your coach to go over all of your instructions. If you have any questions or concerns after discharge, you should always check with your doctor, but your discharge packet will also include the phone number of the orthopedic navigators. We are an additional resource for you to utilize. When it is time to leave, our staff will help you into a wheelchair and bring you down to the entrance where your transportation will be waiting. As we said earlier, after surgery, our goal is to help you return safely to your home. It bears repeating that after surgery, you are not to participate in strenuous exercise or return to the gym until your surgeon agrees. The best physical therapy is getting up and walking around. It is important to move and change position frequently. You may perform all self-care activities unless otherwise directed by your surgeon. Most spine surgery patients do not need any home care services. Should our therapist or medical team feel it necessary, a nurse or home therapist may be sent to your home for 1 to 2 safety visits. If you live alone and are concerned about going home, we recommend you speak to your family or friends to see if someone can stay with you. It is not required, but you may feel more comfortable with someone. Another option is to hire a companion. This is a person who can come to your home for a few hours a day or even 24 hours. They will cook, clean, and help you with your needs. Your insurance will not pay for these services. Your case manager or orthopedic navigator can provide you with the name of these agencies, but you will have to make scheduling and payment arrangements. Upon discharge, you will periodically receive follow-up phone calls. Sometimes it will be by your navigator, while other times it will be through your recovery coach tool. We will enroll you in this program before your surgery. We want to make sure your recovery is going well. We want to answer any questions or concerns. If home care was necessary, we want to make sure they are doing their job appropriately. Most of all, we want to assist you so that we can prevent any unnecessary return visits to the hospital. We are honored that you are choosing and trusting the spine team at St. Vincent's Medical Center for your care. We hope that you found this information helpful. We look forward to meeting you and delivering a world-class, exceptional experience.